Hello and welcome to this recording looking into running retraining as part of the knee module. So we'll be looking into specifically into chronic knee pain in runners, and this is something which we'll highly recommend in runners with patellofemoral pain because it's a bit of evidence there to support us, and it's quite a simple intervention. So it's looking into the overview of the biomechanical principles in running retraining, practical application of running retraining for common patellofemoral running related knee injuries such as patellofemoral pain, and we'll be using video analysis case studies to illustrate running retraining. So that will be sort of our key aims here. So looking at the biomechanics principles and practical application using case studies, which is sort of one of the best ways to learn. Now I think I go through this in detail on the module on gait analysis, but always good to refresh that running and walking. There's key differences here. There's a float phase in running. There is no double support in running. Running is either on one leg or no leg. The base of support becomes smaller when you run. The pelvic tilt is slightly increased to improve hip extension, and the arm swinging is really important to get that momentum and to prevent excessive rotation of the trunk. And your injury history, your BMI, your shoes, all these things can affect how you run. So it's quite a complex area. So I would refer the listener to the gait analysis module to know more in detail. And some key terminology here: kinematics is motion, kinetics is forces, and muscle activation. So, and I'm sure the readers are aware of, the listeners are aware to terminology like cadence, step length, step width, and step stride length as well. So the cadence is really important with running related injuries, especially with knee. So that might be something which we'll go through. And some technical words here. So the normal cadence can be anywhere from 170 to 190 or 200. The bounce is the vertical oscillation. Obviously a little bit of bounce is normal. You're not going to see a runner with zero bounce. So bounce value under 10 centimeters are considered acceptable for most runners. Braking is the how much your speed slows down on every step. That naturally happens, but if you're overstriding, that will lead to increased braking forces. That's why we generally don't like excessive overstride in runners. And also looking into proximal control, like your pelvic drop and pelvic rotations, side to side movements, which could lead to a lot of energy. Now increasing cadence is something which we use a lot in runners. So the idea is quite simple, is to reduce the impact forces to the knee. That's how I explain to the patients. So quicker steps will lead to reduced stride length, which will reduce the patellofemoral joint forces. So from a motion point of view, the knee flexion is reduced. You reduced your overstride. You reduce peak adduction, which are all beneficial and also it's an easiest variable to manipulate. So increasing it from 5 to 10%, maybe 5% in a novice and 10% in an experienced runner, and also reducing your impact forces, your loading rate, and also you're improving your muscle activation in your glute max and glute med, and also your gastrocs and rectus as well, and also reducing your peak loading rates as well. So it's a very attractive option. Increasing cadence is a very attractive option, given that it's easily trainable by auditory cues and it can have immediate effect in loading patterns. And also it can load, enable to supplement your rehabilitation program as well. And it reduces knee energy absorption, which is really important for somebody with a pain. One of the key effects how which cadence works is by reducing the stride length. So when you shorten your stride length, either by increased cadence, it reduces your load to pretty much all joints. Foot strike is not so important as reducing a stride length. So shortening one stride by 10% decreases nearly all lower extremity contact forces, and that might be potential to decrease overage injuries linked with joint loads. So that's something really important to be aware of. And a common question which is asked by everyone is, do all injured runners need running analysis and retraining? So in my opinion, it's not necessary. Not all runners require a gait analysis, especially if the injury is acute. So it could be purely a load management issue. So poor running form and training techniques could contribute. So generally in clinic, I don't analyze anybody's gait. unless they can run at least 20 minutes pain free. So I wait for them to do at least 20 minutes and then look at their patterns. For me, there are 3 benefits. So if somebody is not able to progress, if they're returning to running after a long injury, and if they're having issues with their deficits, so it's sort of very useful adjunct as part of their general rehab. And most of the time what I use is a 2D video analysis. I'll use my iPad to look into how they are distributing the loads, considering the whole body mechanics, looking at the load distribution, looking at the atypical kinematics linked with injury. So this is something which we can use in the clinic as well. So the whole point of running retraining is not to make people run in a particular manner, to see if we can reduce the tissue load, to see if there is any movement pattern that can be altered, and try to facilitate that. So that's the whole point of the coaching process, is certain things are more difficult to change. For example, pronation, hip internal rotation. Certain things are easier to change, for example, overstride. So it's knowing the limitations of your training. Not everything can be changed by gait analysis, so it's really important that you're aware of the limitations of these sort of things. And this is a recent article from Vanata in 2002, is looking into biomedical risk factors for running related injuries. So what they found it was it's linked by injury factors, gender, level, and foot strike pattern. So in female runners, it seems excessive hip adduction and rear foot eversion may be important factors. So I think I see this a lot in female runners with knee pain: excessive peak hip adduction and rear foot eversion. So this can be altered by gait retraining, and in some cases by giving orthotics as well. So for me, when you analyze somebody on the gait analysis, their experience and the gender, very important factors. So if it's a more experienced runners, I may look in things differently. Now let's go into some practical applications. So I think we covered very briefly on the theory. So somebody comes to the clinic with knee pain, with running, could be patellofemoral pain, could be patellofemoral OA, could be fat pad, could be tendinopathy. It doesn't really matter for me. When you look into running related knee pain, when I look on the running analysis, I look at these 5 variables. Overstride, extremely common, which is usually linked with slow cadence. Next is straight knee, landing, vertical bounce, and increased hip adduction. So overstride is usually linked with higher impact, and high heel strike will lead to generate very high impact forces. So that sort of is really important to be aware of in this sort of scenario. So I'm not trying to see how they necessarily move the trunk and other things. For me, I'm really interested in these 5 variables, and if they have overstride, if they have excessive vertical oscillation, I might change that to see whether that makes improvement in the symptoms. Now overstride is really important, and let's spend a couple of slides talking about that. So this patient, this is more like a mild overstride. I'll show you an example of massive overstride in a minute. So you draw a line from the body center of mass to the floor, and look at initial contact. So from the center of mass, draw a line, look at the initial contact and that distance. So the longer it is further, then it's an overstride. But what I'm more interested is in the tibia. So generally I like the tibia to be slightly sloping, not vertical. So let's look into some examples of overstride, which will make it clear in the next 1 or 2 slides. So as you can see here, this is overstride, sort of they're much further away, whereas this is with correction, they're a bit more closer to the body. So I think this is sort of what we meant, is landing with excessively in front, having a straight knee. That puts a lot of impact onto the knee. I also have an example on the video, so I can show you the video here of a runner with knee pain. So that's why it's really important to slow it down. So when you look in fast motion, you can't really pick it up. So let's slow it down, and then it's sort of, you can appreciate that. So this is, you can see straight knee. Let me bring it down, and as you can see here, that is a massive overstride. So nearly she's hyperextending when she's contacting. She's landing sort of where is the center of mass is here, and the foot is landing there, and it's hyperextending. So it's not a surprise she's ending with a lot of pain when she runs for a long distance. So that is something which I look nearly always in. I can't overemphasize the importance of looking at overstride. So when you look at the evidence, there is good evidence here to support the use of real-time and audio feedback. So especially in a clinical setting, the evidence supports the use of real-time visual and audio feedback to improve running form. This is from JOSPT. So, and particularly for patellofemoral pain, there seems to be good evidence to support that. So there's growing evidence, and I'm going to show you just one article on that. So this is from Chris Brahma, where he looked at single session of gait retraining. So what they did was they increased the cadence by 10% using a metronome, and they monitored it with GPS. So that is something which showed a significant improvement in pain and function in patient. The single session leads to lasting changes in pain levels. So at baseline, and the effect was maintained for 4 weeks and 3 months, which is quite amazing. Obviously, they had to maintain it by themselves with few more sessions by monitoring themselves, but it's something which you can apply clinically, quite useful as well, which I find is very relevant for clinicians like me. And cadence, I can't overemphasize, as I told you before, the main reason cadence works is it reduces your ground contact time. You land softer and you don't overstride. So nice infographic here which looks into all the changes what happens when you have an increased stride as well. And a common question people ask me is, what's the perfect cadence? I don't think it's a perfect cadence. If a runner comes with knee pain and his cadence is less than 170, I'll always increase it. So for me, a good cadence is anywhere from 170 to 190. If a runner comes to me with knee pain and the cadence is 177, I will not change it. I'm more likely to try other strategies. But anyone less than 170 with most running related injuries, I'm going to change that. And there's a lot of ways to increase it. Quite simple. You can use apps, you can use smartphones, you can use timer, you can use a Garmin watch. So preferably I use an app called Metro Timer, which is on your iPhone, iPad. It's also available on Garmin watches. So it's so simple, and most runners now know that. That's something which you can easily change. Now, we have to be very careful when we increase the cadence. Sometimes we might increase it too much too soon. So giving an example of a patient here. So this patient came to me with right side patellofemoral pain for 3 years. He's training for half marathon. I increased the cadence from 160 to 175, and he sent me an email within a week saying like his knee pain has vanished, which is amazing considering he had it for 3 years, but then he's getting pain here on his tib post tendons. So it seems the knee is happy, but the foot is not happy. The ankle is not happy with an increased cadence. I guess we're putting more strain on the calf and also use tib post muscles. So what I did here in this patient was I reduced the cadence from 175 to 170. I reduced the speed, which will always offload the foot, and I asked him to reduce the volume by 20%. And that seems to help the patient. A top tip here: whenever you make any changes with the cadence, ask the patient to report any new symptoms if they develop within the first 1 or 2 weeks. So really important that they let you know so that you can make the changes really quickly and make them avoid getting. What you don't want is, if this patient keep on running with this, then in 2-3 months he'll come up with the new tib post tendon injuries. So we don't want that. So I'm going to share you some tips which is very useful when you increase the cadence. So first thing is, start small. Avoid jumping into 15%. Start from 5 to 7.5% when you're dealing with patients as well. Second thing is, allow at least 12 weeks. So when you're increasing cadence, for example, from 162 to 170, don't change it every 2-3 weeks. I give them at least 3 months for them to adapt before they go to the next cycle. And try not to increase it within 2 months of an event. Especially if they're going for a new event like a half marathon or a marathon. Best not to do before an event. Try not to increase cadence and volume together for at least 2 weeks or 5 runs. So that's really important. And try to go for a lighter shoe, less than 250 grams if possible. And whenever you increase the cadence, it's really important to know that that you're going to put more strain on the hamstring and calf muscle. So maybe you can give them some strength program to facilitate that with these patients. Another common thing which I see with runners with knee pain is increased landing, with heavy landing. So this study has shown that high impact loads, so nearly 250 female runners for 2 years, and people who develop injuries tend to land harder. I find it particularly in runners who wear headphones and they're landing heavy. They don't notice that sort of increased vertical loading force. So this is something you look at when you're on the treadmill. If it's too noisy, too landing heavy, quite simple to change. Ask them to land lighter. So that's something you can change quite easily. And the next one which you see in runners is this sort of vertical oscillation. They're jumping up and down. So in this video we're looking at increased vertical oscillation. So try to take a line through the pelvis at the highest point, which is the flight phase, and then the lowest during the mid stance. So that's where you're jumping highest at the flight phase, and then you're the lowest at mid stance. And obviously it's going to have a normal 3-5 centimeters. Less than 10 centimeters is considered normal. So when you're overstriding, so normally you overstride or you jump up and down because of two reasons. Your cadence is too low, or you have reduced hip extension. So if that is the reason, you're more likely to go up and down. So instead of running, you basically what you're doing here is you are going like jumping up and down. Simple way to change this is, one is increasing cadence or asking them to run light. We'll go through that in a second. So the different ways you can do that. For the first thing is increase the cadence, show them on the mirror, and improve hip extension, teach them plyometric drills, land softer. So the easy one is increasing the cadence and ask them to land softer. That usually works. So you can use any of these cues to make the difference. Another common pattern which you're going to see in female runners is with knee pain is increased hip adduction. I don't like this kissing of the knees. You can see there's no gap here, and studies from Brad Neal has shown patellofemoral pain in females. There is increased hip adduction in runners with patellofemoral pain. So again, we have to be careful here whether it's a chicken or egg, whether people develop this after they get pain, but that might be a target to improve, especially if they come to your knee pain. And we got a fantastic study here from Rich Wiley from 2012, where he did mirror gait retraining. Looked at in front of the mirror. He took at 10 female runners, full length mirror, 8 sessions, and these are the cues he used. Push the markers apart, keep the markers level, and sometimes they use things like don't let your knees kiss, push out open. So before retraining is this, and after retraining is that. So you can see how the running retraining has made a big difference in how you make the open up their knees and increase hip adduction and prevent that excessive altered medial collapse mechanics. The last one, which I rarely use, is some coaches will encourage a little bit of forward lean. So if you're more upright, it puts more strain on the quads. If you're leaning forward, it takes on the glutes. So if you normally around 10 degrees to 10 to 11 degrees of trunk flexion is normal, it reduces your knee forces by 17%. So a little bit of forward lean is not a bad thing. But again, it's something you have to be careful that you don't end up bending too much and causing other knee injuries. So this takes time, and in my opinion, this is best done by a running coach who has more time. I rarely use this. The most common things I use is reducing peak hip adduction, increasing cadence, and reducing vertical oscillation. Those are the most common things I use. So in summary, when we look into gait retraining in runners, you got plenty of options really. There's a lot of options here to reduce the pain. Let's start with the most common one. First is increasing the cadence. Let's be not be too aggressive. Start with 5 to 7.5%. Use a metronome. Use it for a couple of sessions. Use them when they're going outside. That can help, and that naturally goes with reducing overstride. If they're noisy runner, if they're jumping up and down, reduce the noise, and that will reduce the vertical oscillation. And if you've got a female runner with excessive peak adduction, increase the knee window by giving cues, by opening up. Imagine that you got a golf ball or a tennis ball between the knees, and open up your knees as well. So the things I rarely use is increasing trunk lean. So I don't really change that. Some people change the foot strike to mid foot to forefoot. That's a good strategy, but you have to be careful that it could lead to more Achilles and foot and ankle injuries like Morton's neuroma and stress fractures. Sometimes barefoot running on the treadmill is useful to get them sort of into the pattern of more natural method of running as well. So it's finding what works for you, and there's a lot of verbal cues you can use before you make those sort of changes. Take quick step, take short steps, run to the beats, land under your hips, land softer, reduce your noise. So when we make changes in a gait rate training, it's not a quick fix. So I always ask myself, first, have I given them good advice on load management? Have I reduced their downhill running? Have you reduced their excessive junk miles? Second thing is, have I given them a good strength and training program? Number 3 is it possible that I can change this with gait rate training? Certain things can be changed, for example, overstride, decreased cadence, but certain things can't be changed, like pronation, hip internal rotation can't be changed by gait rate training, or much harder to change. And is it the best time to change? If they got an event coming up in 3 weeks time, is it a good time to change their gait cadence, especially if they're doing a new event? And what are the side effects? Everything you make will have an effect somewhere else on the body. Will it increase the risk of new injury? So it's something to ask yourself, is it the best thing to do? And if not, how can we reduce the risks? So that's why when we make the cadence, we always start with short steps, increase by 5 to 7.5% and take it from there. And last but not very important, let's not overcomplicate it for the runner. Rather than giving very complex cues, keep it very simple. Complex thinking but simple intervention. That's what I say to my patient. So let's not make the runner think too much and make them less efficient, because if you make it too complex, you're going to reduce the efficiency as well. So that's something which we need to be aware of. Now, gait rate training is an important element, but it's not the main treatment for running injuries. The number one treatment is good education on load management, making sure that training volume is appropriate, good strength and conditioning, trying to improve their loading capacity on the muscles, bones and tendons. And in some instances, if I'm treating 10 runners with running injuries, most likely 20 to 30% of runners I will make changes. 70 to 80% I will not make any changes. But it's really important that you look at the gait analysis, because all runners expect you to do that nearly always. So it's part of their management. Runners like that. They appreciate the time spent on their looking at the gait analysis. So again, if you got a runner with chronic knee pain, it's a fantastic tool to look into, and that's something you don't want to miss, especially dealing with patellofemoral pain, which is number one injuries in this condition. So that concludes my talk on gait rate training. If you need further information, I would recommend to look into the knee module, where I go through everything in detail, especially on running rate training and gait analysis. Thank you very much.